Hi, welcome to Breaking the Limits. I'm your host, Laika Shawn. Today on the show, I have two guests for you, Lorena Anderson, energy shifter, and Dr. Michael Proper, orthopedic regenerative specialist. See you after the break. Hi, welcome to Breaking the Limits. Tonight I have with me an energy shifter, Lorena Anderson. Thanks so much for joining the show. I can't wait till you get a chance to explain to everybody what is energy shifting. I know it has to do with internal energy fields, but I'll let you explain it because you're the expert.
Okay.
Okay.
Well, as you well know, we are energy fields, okay? And we emit a lot of energy in and through and around our bodies. So what you end up feeling is something that's inside the body, the internal energy. You can feel it. It's kind of like when you, say you're sitting at a table and somebody walks up behind you. You can feel that individual.
The little hairs on your neck.
Exactly, because it's the energy that's coming up. And that is one of the things that you start learning about, how that energy is, where you end up taking that energy, understanding how it manifests itself, how you function in this world because of that energy. And, you know, a lot of times what ends up happening is that we get all of our energy stuck in the negative. So when that happens, all of a sudden you start feeling depleted, you feel low, you lose your passion.
Have you noticed that people tend to gravitate towards the negative experience over the positive? And do you have any theory on that? Why that draw?
Yes, absolutely. What happens is that whatever you put, we move energy in two ways. One is via your attention. So whatever you put your attention on grows. That's quantum physics.
Right.
Okay? The other thing happens to be through your breath. When you take a slow, deep breath, you can feel that energy coming down into your body. You can feel that life force. It's like warm. And it also sometimes can leave tingling in your fingers. So that's what you want to do. A lot of times what happens is that something negative happens and all of a sudden we get stuck. We get stuck up in our head and we keep thinking and thinking and thinking. Yes. And we got to figure it out. We got to try to work it out. And what is this all about? Well, what's really happening is that we're putting more and more energy into that head.
So we're sitting here thinking we're fixing it, but we're actually making it bigger?
We're making it worse. Because the answers don't come through your head. Okay? Your answers come through your intuition, through your internal energy field. So one of the things that I do is that I help teach people how to just get present, how to get in this very moment. Absolutely. It quiets the mind. When you have the ability of quieting the mind, you can reconnect to that internal energy field and then start to identify, okay, where is it that I need to go? You know, your intuition has never lied to you. Never. Your head
just kind of overrule it, don't you? You overrule it.
Oh yeah, you never listen to it. You know why? Because you go up in your head, and then you have this great big argument, and then pretty soon it's a war. I call it the mental mob scene, and it just keeps going on and on and on, and it becomes really quite difficult then to figure anything out because what happens is that we bring the past with us.
Oh yeah.
Okay.
Know that one.
And in that past, we get stuck in it because we're so afraid of moving forward, making the same mistakes. But what ends up happening is that we take that fear that we're feeling and it's distorted, and then we try to make those decisions. So our decisions, our attitudes, our behaviors, everything that we do is based on the fear from the past. Well, you can't create anything moving forward based on distorted views of what you think might happen in the future. So energy shifting is when you have the ability of understanding where that energy is located, where you're feeling it in the body, being able to dissolve that.
So you're saying those memories are stored in a particular part of your body, and you're actually dissolving the hurt with the energy field?
You're dissolving not only the hurt, but the contraction. Because all you have to do, you know, you can bring up a situation and you can feel it immediately because the emotion doesn't know whether or not it's happened just now or 15, 20, 30
Yeah,
years ago.
I've been told that by specialists that are, have degrees in psychology about how your body does not know the difference between time. So that's why trauma sticks, and if you relive it, if you just go right.
Guess what, though? It's greater than that. It's also an energy contraction that will create and attract itself over and over again.
Ugh.
So
it's like glue.
It is the glue, absolutely. So one of
snowballs.
the things that you have to do is start releasing some of that negativity within your physiology.
Mm-hmm.
And once you do that, then you have the ability of shifting your energy into your positive, into your empowerment, and really start building, extracting all the beautiful, magnificent qualities that you experienced through those so-called adversity situations. Start extracting. Let's say, were you more courageous? Did you learn how to stand up for yourself?
So you're saving the good and scrapping the bad, kind of?
Well, everything, we learn from every single experience. The problem is that when our energy gets stuck in the negativity, we can't extract the positivity out of it. I'm one of the greatest cheerleaders. Something bad happens, I said, okay.
Pom-poms, right?
Yeah. So what did you learn about yourself new this time because of that? Where are you taking yourself?
I must be the wisest woman on earth by now.
Touche, honey. Absolutely.
So you got to tell me, because there's a lot of people out there that don't know you. You've been doing this for how long, and you have your own business around it. And can you explain a little bit about you, who you are, and how you help people?
Absolutely. I have been in the field for 15 years. I have my master's in social work. I had done addictions counseling for 3 or 4 years and decided that was really great foundation, but there was so much more of me available. And I really wanted to start dealing with people that were committed to their own healing. Not saying that, people that are addicted aren't committed, but when you're working in the agency, a lot of times they're there because of being mandated.
So not by choice, but by force, sort of.
Exactly.
Okay.
So I started training with a woman, her name's Debbie Ford. She was an author of about 8, 9 different books. Unfortunately, she recently passed away from cancer. But she was one of the foundations, understanding the shadow effect. And then from there, I knew that there was more to your life than just shadow and trying to make friends with your shadow. So what I realized is that a lot of times what happens is that we take that shadow and we're trying to get to our empowerment. Well, we're still carrying around with us that negative energy trying to get to our positive. Does it work? Yes. Does it take years? Yes. With my tools, it's fast, it's effective, and it's easy. It's very, very simple. And we release ourselves from negativity, you release it out of the physiology, and then you shift your energy into your empowerment. And when you have that ability of doing that and then building on that, that's what makes the transformation in your life. So that's why I'm called the energy shifter.
The energy shifter.
Yes, yes. And yes, I do have my own business. It's been based on the tools and techniques that I teach, and also based on the modalities of academia as well, being the fact that I do have my master's.
So it's a blend.
Absolutely.
You take the best from both worlds.
Yes.
Right?
And I also add spirituality in that as well. That happens to be a big part of who we are, the spirit inside of us. So it's activating that spirit.
Now, is that term that you created for this, is that your own term, or
Yes.
it is? I like it.
Thank you. Yes.
Good.
Because we're all energy, so it's understanding how we function in this world based on that energy.
Should we be looking for an energy shifter book?
Yes. As a matter of fact.
I figured.
It's in the works. It is absolutely in the works. And upcoming workshops and seminars as well.
So what do you do? What's the list of things that you do to help people besides the actual one-on-one sort of energy shifting counseling, if you will? What else are you doing? Are you speaking? Are you going into speaking? Are you?
Yes, I'm out doing different speaking engagements.
What kind of clients do you speak to?
Oh my gosh! I mean, I just finished a speaking engagement for what is it? The Pan-Hellenic organization. That happens to be an organization that deals with women's sororities.
Oh, okay.
Yes. So that was a couple of weeks ago. I've got an upcoming engagement for a financial institution, UBS, and I'll be speaking to approximately 9 of their offices, going around talking to them, because a lot of times, one thing that I really want to stress as well is that when you end up being able to get present in the moment, quieting this, getting more in touch, it's a stress reliever. Absolute, total stress reliever. And it's instant. I mean, people who haven't been able to turn off their heads for years and years and years.
Yeah, you get a real spin with that.
Oh, yeah.
Obsessive thinking.
Within 10 minutes, it's quiet.
So is that what you talk about with the speeches? You actually show quick techniques?
Yes, absolutely.
Okay.
Absolutely. And then talk to them about the beliefs that they carry within them.
Yeah, that's a strong one.
Well, it's the beliefs, they have a vibrational frequency to them. So if you've got a belief that's running that I'm not good enough, you are going to emit those lower frequencies, and what will happen is that you will start creating and attracting, because like energy begets like energy. So you'll start creating and attracting because that belief wants proof.
Yeah, what's the deal with that? What's behind that belief wanting proof? I want to wear it gets little legs and goes on by itself.
Well, what's really interesting is that that's the way that we know that there's a wound that needs to be healed in there. And that's
so maybe
one of the
we're
reasons
paying
why.
the wrong kind of attention to the wound. Maybe we just don't know how to.
We don't know what to do with it.
Yeah.
So what we do is that we reject it. Oh no, I'm not going to feel that. Are you kidding?
Yeah.
That doesn't feel good. Who wants to feel that?
Yeah.
So what we do is that we start rejecting and pushing away. Energy doesn't understand pushing anything away. All it understands is that you've got so much attention in there, and it's negative
So it's like
attention.
you've got a pointer going blink, blink. Look at this.
Yes. Come at me. Come
Yeah.
at me. So that's very self-destructive and self-sabotaging, and that's one of the reasons why we do.
But it's so counterintuitive.
Oh, I know. But see, a lot of times all these beliefs are so subconscious.
Yeah.
You know, it's kind of like the iceberg effect.
Oh yeah.
Your
Heard
consciousness
that
is about
one.
that big. Yeah. Your subconscious is running underneath all the time, and it's creating and attracting.
Yeah.
So, especially, if there's something that we don't like, we push it down. We keep pushing
Bury
it down and burying it, and we don't want to deal with it. Well, it's going into the subconscious. We're creating it anyhow, and you can see it reflecting on the outside of your
You didn't
life.
give us manuals for this stuff.
Well, we've got the manual
You've
now.
got the
honey.
manual.
Absolutely.
Lorena has the manual.
Yeah, absolutely.
So you're gonna have to tell everybody where they can get the manual, because where do people find you? How do we get hold of you?
You can visit my website, www.theenergyshifter.com. You can also write to me at Laurina, Laurina, at theenergyshifter.com. Or you can just call me. I answer my phone, believe it or not.
Wow.
407-340-0301. And I look forward to any questions that you might have. Anything that you want to know about energy, where to take it, how it manifests, what you're creating. If you're stuck, if you're having a tough time making decisions, just call, email me. I answer.
Now, do you have like a little form on your website or something? People can say, hey, I want to know more?
Absolutely.
Okay, that's always good.
Yes, an opt-in box, it's called.
An opt-in box.
Yes,
everybody.
an opt-in box.
Well, I know we have about 2 minutes left, I think, or 1.5 as it is. So, do you have any last things you want to share in that time frame, since we're going to have to come to an end?
Absolutely.
Okay.
To access and accelerate your maximum potential, start dialoguing with yourself, understanding the beliefs that are running underneath. When you have the ability of starting to see those negative beliefs, I want you to shift it to the positive. Exactly the opposite. So say that one of the beliefs is that you don't matter. I want you to start writing out all the ways that you do matter, because everybody's telling you how much you matter, but you're not listening to it. So I want you to just take that sheet and do the opposite. I do matter. Here's what I have done in my life. I'm not good enough. Really? I had a not good enough inside of me too. My not good enough had me going back to school at age 37, had me continuing through school with magna cum laude, got into advanced standing with a 4.0 1 year in and out with my master's. But you know what was really wild? I still felt like I wasn't good enough.
Because it has nothing to do with the fact that you aren't good enough. It's a belief structure.
It's a belief structure.
Yeah.
So, and those patterns repeat themselves over and over again. When you have the ability of starting to bust those patterns, identify them, and start putting your attention into your empowerment, your vibrational frequency starts coming up, and that's where the joy is.
Yes,
That's
so
what the
you start
happiness
feeling
is.
happy.
Absolutely, and not only do people want to be around you.
Yeah, you naturally attract people that are in a higher vibration. Then,
Absolutely.
Right? Yeah.
And that's the best place to do business from as well.
Yeah. Yeah. She's vibrating, people. Thank you so much for being on the show.
you.
It's a pleasure to see you again. I haven't seen you in a while.
Oh my God, it's great to see
Yeah.
you. Thank you so much for having me.
Everyone,
It's
Lorena,
wonderful.
and you now know how to get hold of her, so give her a buzz.
Thank you.
Welcome back. Today I have Dr. Michael Proper, who has joined us to talk about regenerative orthopedics. Welcome to the show. Thank you very much for joining us.
Thanks for having me.
Did you want to explain to people what actual regenerative orthopedics is?
Yeah, it's orthopedics, which is the treatment of basically all the musculoskeletal parts of the body, the joints, ligaments, tendons, and regenerative meaning we get it to the body to heal itself and fix itself by intervening, not necessarily in a surgical fashion. In other words, these are procedures that are done in the office generally, and are effective at treating a lot of orthopedic maladies that don't require surgery.
So is that like outpatient surgery? They come in and they leave the same day, or do they?
It's not even surgery. It's the procedures. But it's done in the office,
Wow.
so it's not even a surgical center.
That's great. I know a lot of people are pretty terrified of anything that says surgery. Or...
No, this is not surgical. There's special types of injections.
Okay, and
procedures.
I understand. Did you want to talk about what those injections are? There's a variety of different types, correct?
Yeah, there are a variety of different types. It's everything in orthopedics is old and then becomes new again and becomes old again. So we've been working with stem cells in orthopedics for 100 years, since they started taking bone grafts, which are pieces of bone to heal broken bones. And those are stem cells. Bone graft is a stem cell.
Oh, is that like bone marrow transplant, or is that different?
No, just taking a piece of bone. If you let's say your shin bone's broke and you're going to put a plate and screw in it, and there's a defect, and you put a piece of bone in to bridge that defect, that's stem cells, because that's where it comes from, the marrow.
Okay.
So this really bridges from this, and orthopedists have been working with stem cell type therapies for a long, long time. So basically, what we do in the office are FDA approved, in terms of the machine being FDA approved that we use, procedures to get the body to heal itself by taking your own blood and putting that back in under X-ray control, so we know exactly where we're going, what we're doing with it under local anesthesia.
So you're really harnessing our own regenerative power. You
Exactly.
use the same part of your own self to heal yourself.
Yes.
Wow, that's
And there's different strengths, and it all depends on what the joint is or what the problem is as to how much strength you need.
Now, when I was talking to you a little earlier, you mentioned that one of your major clients are people that need knee or hip replacement?
Yeah.
Because they don't want to go in for the standard surgery?
Right. There are people that just don't want to have surgery, or shouldn't have surgery. For medical reasons, they have hardening of the arteries to the legs. The total knee replacement requires a tourniquet. Hip replacement, you have to go into the hospital and a rehab facility. Although the hip replacement would be the right answer, okay, because it's a very good operation, okay, and the right patient. Not everybody should have it. Not everybody can have it, okay. If you're not mentally there to have it and go through the rehab, just like a professional athlete, you shouldn't have it. And those are the type of people that I treat. And we have now they have an alternative.
Okay.
So they don't have to be on pain medications or anti-inflammatory medications, which cause heart disease, actually.
Yeah.
Even Advil and Motrin cause heart disease. So you don't want the people on that long term. So what we have, it's almost like what the rheumatologists do in kin of a biological treatment.
So I understand you have some first-hand knowledge of being an athlete. Didn't you originally go into the medicine because you injured yourself?
Yes, I have multiple injuries.
And then you found that was the
Football and track.
That's probably you probably have a lot of.
Yeah, I have a very bad knee and a shoulder, and I'm doing fine. But these procedures are for people it's very advanced sports medicine. It's used in the NFL all the time. We use a procedure called PRP, which is platelet-rich plasma. Okay, there were 2 people that played in the Super Bowl that got their shoulders injected 3 days before they played. This is where we take blood from your arm, from veins, just like donating blood or having a blood test. Treat it and inject it into the joint with a very high concentration of platelets. That's the main thing that we do. We do a second procedure where we take the blood from the bone, and we actually do it in the office. And we use hyperbaric oxygen to increase the stem cell count.
Oh, wow. Okay.
And so, and we have very good success with that.
Now, I took a look at all the different things that you have listed on here. It even has things that you do for menopause, things that you do for liver detox. There's just a variety of things you use this for, it looks like.
Yeah, what I do is I have a fellowship in regenerative medicine, but I tailor it to orthopedics. So when someone has a really big stomach, if you don't treat the big stomach, which is in a male generally symptomatic of very low testosterone levels,
so hormonal imbalance, right?
You're not gonna be able to treat the knees and the hips. So you have to get rid of it, and diet doesn't do it, and it's a form of type 2 diabetes called metabolic syndrome.
Okay.
So we treat that, and we that's why we use the testosterone treatments, because you have to get the stomach off the person. We do use the bioidentical hormones, the Suzanne Summers type hormones, but I only use it for people that have osteoporosis, which is weakening of the bones, because I've come to believe that this is probably the safest way of treating it over the drugs that are out today. Because if you have weak bones and you fracture your hip, the chance, most people fracture their hips, 30% of them are dead within 2 years, no matter what you do. And it's 100% surgical. So it's something you can intervene with. So that's why we do that. But it's all geared towards orthopedics and sports medicine of the bones.
Now, I did hear that you also had another story. You originally were in surgery. You were a surgeon, and then you decided to switch tack to regenerative orthopedics. I didn't know if you wanted to talk about what brought you to that, or. Well,
about 11 years ago, I had LASIK surgery, and essentially the machine went through my eye, and I lost my depth perception, so I had to give up surgery.
Oh boy!
So we had to go through a lot with that, and I was patient at Johns Hopkins Hospital. That was unpleasant, and subsequently I have not had a corneal transplant, which I don't want, and so that's why I went to regenerative orthopedics. So, you know, there are other people doing these PRP or what are called BMAC procedures, ones where you take the blood from the vein and ones where you take the blood from the bone. But I'm an orthopedist doing it, so it's a bit of a different tact. I think it's much easier to treat these things when you understand what the body looks like from the inside.
Yeah, I know there was a lot of press around, and I don't know what it was called, so forgive my ignorance on this, of taking blood out and pumping it back up, someone's own blood and putting it back in, and there was a big hullabaloo about this being something that athletes were doing to get pumped up with their energy, but that's very different from what you do.
That's oxygenation.
That's oxygenation, okay.
No, we take the blood out, and we get rid of all the components except for the platelets, which are little cells, or not really cells, they're cells that make the blood clot, but they have growth factors. They make stem cells come in, and that's called PRP, platelet-rich plasma. And our machine is, I believe, the only one that's FDA approved. And we inject that under a fluoroscope, which is an X-ray machine, so we know exactly where we're putting it into the joints of the body.
And it helps us regenerate and heal.
Yeah. It's unbelievable. I mean, in certain areas it works really, really, really well. But like everything, it has its limitations, and you have to know what works and what doesn't work.
Yeah.
And
I know I have a lot of friends that have rotator cuff injuries. Would that be something that would be used for?
Yeah, absolutely partial rotator cuff injuries, lateral injuries, which is the cartilage inside the shoulder. Mm-hmm. If you have a completely torn rotator cuff that's retracted, surgery is the only answer for that.
Oh, okay.
And that's why you really need to see a surgeon that does this, because at least you'll be guided correctly. You know, there are certain non-indications for this where you really do have to have surgery.
Now, I heard that also you get a lot of referrals from chiropractors who send people to you, and then you work with them to help the patients then go back to the chiropractor. So it's kind of symbiotic. In that respect?
I'm sort of like like an endodontist is to the dental practice. You send me the patient, I'm going to see the patient 3 times, okay? And then the therapy and the maintenance therapy is very important, and especially core strengthening. A lot of evidence now is showing that you live longer because of core strengthening. And that's why people need to maintain their chiropractic or physical therapy care, so we don't have physical therapy or anything in our office. We're adjunctive to them, but they get to a lot of points where their treatments are not working, or they're at a hump and they can't get over it, and I'm the guy that gets them over the hump.
Yeah, I have some first-hand experience with 3 herniations in my back, so I've had that. Once you're down, and trying to get that back together again. So I'm very curious about how these types of treatments are progressing.
Most importantly, people, how do I say it? Old school medicine, and I went to a very old school medical school, Columbia University, was taught physical examination. And when people go on the internet and look things up, it isn't like you're the Addams Family and Cousin It comes out with a hand thing and does a physical exam. Just because you have spinal stenosis on an x-ray, or you have herniated disc on an x-ray, that does not mean that that's the cause of your back pain. So there may be there's a multiplicity of things that cause back pain. So a physical examination is always required to determine what is causing pain, because it could be something really simple, and the disc could be just there, but it has nothing to do with it. If you were to take an MRI of 100 people that were 48 years of age and above, that never had any back pain, never had any complaints, 50% of these people would have herniated disc, spinal stenosis, and everything. So I don't treat x-rays. Okay, I treat people. And the only way I can do that is by examining them. Okay, so, I don't give advice over the phone or anything like that. I examine people, and I give them their options. I want people to make their own decisions. So, at the very least, they can make their own decision, and whether it's to have surgery or not do anything.
Well, I want to make sure that everybody knows how to get hold of you, because we're running out of time. So could you tell us what the best way to get hold of you and the best way to learn more about what you do for those people out there?
Yeah, they can go to our website, which is actually right here, the Regenerative Orthopedic Group, or Google my name, Michael S. Proper, MD. The best way to get a hold of us is to call our office at 561-221-6700, and we have a really good office staff. They understand everything, but the basis of how we treat is by examining the patients and coming up with a diagnosis. You can't treat someone until you have a diagnosis that you can make a treatment plan from and give them options. And all options have, and then let the patient make the decision. But it's unfair to ask the patient to make a decision when they don't know the options.
We would all be looking to you as the experts to help us understand what we are trying to decide too. So there's always that.
Right, and you have to trust your doctor. But look, if I tell you need surgery, it's probably true. It's probably true.
Well, thank you so much for joining the show. This is great.
Thank you for having me.
And anybody out there that has pain, call the doctor. So thanks again for joining the show.
Thank you for having us.
It starts as a day, like any other. Just a Saturday. Until we start connecting. Over 100 million of us. To turn this day into a movement. Where the small shop across the street gets big support across the nation. A day where communities prosper and main streets start booming. Because when we all come together,
that's the power of all of us.
That's the power of all of us.
Power of all of us.
Amazing things happen.
Wow, what was I thinking? This hurts. Oh no, girls. Keep it cool, eye contact. They see me. They see me. Ow, 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 ow.
What? getting a mommy tattoo.
Ow, ow, ow. Am I crying? I'm not crying. Am I crying?
Sweating on the inside? Handle it on the outside with new Speed Stick Power.
I love her so much.
Aww.
Speed Stick, don't sweat it, handle it.